Good morning, everybody. We appreciate your patience and apologize for the delay. We'll give it a couple minutes while everybody gets into the waiting room, and then we'll get started. So thank you so much for joining us this morning. For those that missed it, thank you so much for your patience. It looks like the number count is going up, so we'll give it just a little bit longer, and then we'll jump in and get started. And we are excited here to have everyone today to talk about the Targeted Case Management MOU template. All right, I think we will get started. Thank you everybody for joining us today. My name is Amara Baharamiarif. I'm a branch chief in the Managed Care Quality and Monitoring Division. This MOU has been developed in partnership with several areas within the Department of Healthcare Services. So really want to thank our partners and LGF and also the Quality Population Health Management Group. So thank you all for supporting the development of this MOU template. So for today's objectives, we plan to review the changes that were made to the county-based TCM MOU template based on the valuable feedback that you all provided to us. Then we'll review next steps for executing the MOU and the MOU execution timeline. And then we will open it up to you all for questions and answers that you may have regarding the MOU template and the execution timeline. All right, so to just sort of level set on the conversation today, we wanted to really just talk through the goals of the MOUs. So many of you are probably aware that the new 2024 contract that we required our managed care plans to enter into requires the managed care plans to enter into a variety of different MOU templates. The targeted case management is one of the 8 templates that we've released in 2024. We're really focusing on many of the goals of CalAIM to really focus on a whole system person-centered care approach. So really putting the member at the forefront of our development. Can anyone else hear me, or is Sophie, can you confirm if you can hear me?
Yes, I can hear you.
Okay, it seems like others can hear us, so I apologize if some people are having some challenges hearing. Maybe check the volume on your computer and or call in if you're unable to hear me. So I apologize. Maybe we can drop that in chat so the person that can't hear me can call in. So really many of the goals that you'll see kind of throughout the template were really establish some of those minimum provisions that you're going to see really related to training and coordination across the two parties. Really clarifying who's responsible for what, given that many of these members are receiving services through different delivery systems, formalizing how the parties will collaborate with one another, and then really providing transparency regarding the roles and responsibilities. So the department issued the MOU template, the targeted case management MOU template, that if you aren't aware is posted on our website. We'll go into that in a little bit more detail later on in the presentation, but really outlining existing service and programs requirements into just one single document. So we've done a lot of the legwork for you and really hoping that that helps the negotiations of the executing the MOU among the parties. We can go to the next slide. All right, so we wanted to just outline that the targeted case management template is a part of a larger set of policy documents that the department has issued and released. So there is a requirement in the MOU APL that we released late fall of 2023, and also requirements in the TCM program guidance that really set forward the expectations of what the intent is of the MOUs and some monitoring components that we're placing on our managed care plans. So really setting forward the intent and purpose of the MOUs, some of the expectations regarding submission of the MOUs, and also, as I mentioned earlier, laying out that monitoring plan. In coordination with that all plan letter that was released, we also issued what we're referring to as our base MOU template that really just sets the foundation of provisions that are included in all of those bespoke templates that I mentioned earlier that we released, which includes about 8 MOU templates that were released that we refer to as bespoke MOU templates. So the bespoke MOU templates are really setting forward specific program roles and responsibilities in this situation. This is related to the targeted case management program. And so we have issued the final bespoke TCM template that contains some of the general provisions that are in the base MOU template and also program specific provisions. That bespoke template also links to the policies that are incorporated into the MOU, whether that be linking to the TCM program guide, the DHCS contract, or potentially the ECM policy guide. So really linking to a number of different policy resources that the department uses to issue guidance to the managed care plans and also the targeted case management program. We can go to the next slide. All right, as mentioned, the department has created this MOU resource page that houses the policy guidance that we just discussed, so that all plan letter, the base MOU template, and also the specific MOU templates. We've also created a very detailed MOU FAQ. It's about 16 pages that really kind of outlines some of the key questions that may come up when you all are executing the MOUs. We will be updating that MOU FAQ in the next month or so, so please look forward to receiving updates on that to really help with the execution of the MOUs as you all work through those processes. We also post other updates on that website. So this webinar today is posted up there, and we'll be posting additional resources as they become available. If you have any questions throughout the process, we are happy to help and provide technical assistance. We really want to make sure these MOUs get executed and really support that whole person-centered approach. So if you have questions, please feel free to email us at mcpmous@dhcs.ca.gov, and we're happy to assist with resolving any questions you have. We would encourage you to look at that FAQ before submitting questions, but if there's additional clarification that you need, please feel free to reach out to us. We're here to support. We can go to the next slide. So for today's conversation, I'm really wanting to focus on the intent and purpose of the TCM MOU, which is really to improve communication and collaboration between the MCPs and the targeted case management programs to really coordinate care for individuals and to really address the non-duplication of services, referrals, and data sharing, ultimately to support that member, right, in receiving the services that they need to receive. So you can see kind of the goals of this outlined throughout the bespoke MOU template that we issued, and many of the provisions that we've made some slight modifications to we'll go through in a little bit more detail in the future slides. So we can go to the next slide. All right, so we did release the TCM MOU template and all of our other MOU templates for stakeholder feedback. For this MOU, we received about 57 comments during the comment period. We have reviewed and revised the MOU template based on these comments, and we really want to thank those that participated and provided feedback. Your feedback is invaluable to the work that we do at the department. So we really want to thank you for your partnership on that. And also thank many of our key partners. Thank you for going back. Such as SHIAC and the LGA Executive Committee for engaging with us throughout this process. We can go to the next slide. And so we wanted to just do a quick walkthrough of those base MOU template requirements that are included in the TCM bespoke MOU template that we issued. So that everyone is aware of some of the key provisions that are required of all of those MOU templates that we've issued thus far. So there's a definition section that provides some defined key terms and or points to resources where those key terms are defined. The services that are covered by the MOU, each party's obligation, that training and education requirement that really requires the two parties to collaborate and train on how they are ultimately supporting the Medi-Cal member, referrals, care coordination, a quarterly meeting requirement that requires the two parties to meet at least quarterly to really focus on how they can improve the collaboration and coordination across the teams, how they can develop quality improvement activities, to really support the members that are receiving these services. There's also a data sharing and confidentiality section, dispute resolution section, equal treatment, and then some of the general requirements that we placed on the managed care plans, such as the requirement to post the MOU on the website and their website, and then also review the MOU. So we can go to the next slide. All right, so when we were developing the MOU template, we did identify the need to provide some clarification on the TCM and ECM overlap policy. So DHCS released an update to the Enhanced Care Management Policy Guide in February of 2024. This can be found on the DHCS website, and really just providing clarification that effective July 1st, members cannot be duly enrolled in the county-based TCM and ECM programs. Now, there are a few exemptions that we just wanted to highlight. So beginning July 1st, members who meet the ECM population of focus criteria should be enrolled in ECM and may no longer be enrolled in ECM in the county-based programs at the same time, except for from July 1st, 2024 to June 30th, 2025 for cases where members are receiving the county-based TCM for addressing a communicable disease or for the sole purpose of receiving a home visiting program supporting a healthy development and well-being of children and family. The ECM provider manual the ECM provider must be the primary point of contact for coordination across physical and behavioral health delivery systems and also social supports. This policy has also been incorporated into the TCM MOU and really describing the roles and responsibilities for coordinating this non-duplication of coverage for Medi-Cal members. So we really want to appreciate the partnership of the program areas that are overseeing the policy for these areas and making these updates to the guide and supporting the development of the MOU template. We can go to the next slide. Right, so the items that are notated in red are the revisions that we've made based on that valuable stakeholder feedback that we received. So really in the first area under the LGA TCM program obligations, just really clarifying the policy documents that support the TCM program. We've made some revisions to that piece of the template that are reflected in the finalized published version of the template that was issued. Also highlighting that the LGA TCM program must share member care plans for members receiving LGA TCM program services with the MCP upon the MCP's request. So really just kind of providing a little bit more clarification on how the parties can collaborate. Also provided some clarification related to members that may be receiving complex care management and regarding the roles and responsibilities for that area, and also those that are receiving community supports. We've also outlined that the LGA TCM program may continue providing those LGA TCM program services to members who are ineligible for ECM but remain eligible for LGA TCM program services. So really a very important piece of collaboration or a clarification that was included in this template, and hopefully provide some clarification across the parties when moving forward with execution. We can go to the next slide. All right, so also some clarification was added to the eligibility screening referrals to LGA TCM program and the MCP regarding the responsibilities that the MCP must notify the LGA TCM program of members enrolled in that complex case management and other programs, so such as community supports and ECM. And that would be agreed upon by a timeline agreed upon by both parties, understanding that there's impacts on both sides there. And then also just calling out in that second part, the policy guidance that was developed and released around non-duplication of services that has been included in the TCM MOU template as final. So really just adding some clarification on that piece. We can go to the next slide. All right, and then we also added some clarification under the coordination and collaboration between the MCP and TCM programs. Requiring the MCPs assess and review the monthly plan data feed files in order to identify members that are receiving those TCM services. So provided some additional clarification there. And then also providing clarification that the MCP must provide the LGA TCM program liaison and other staff with information related to members that need medically necessary services. All right, and then also equal treatment. This provision was provided just to clarify that Medi-Cal members, do not necessarily receive equal treatment above other members that may be receiving TCM services. So it does not diminish the responsibility of the LGA TCM program and MCPs to ensure that adequate administrative capacity, network capacity, and timely service to members still exists. So just provided some clarification there, and then also provided some clarification related to termination of the MOU, understanding that the TCM program does not operate in all the counties. So if that's the case, the agreement could be terminated if the TCM program opts to not provide those TCM services. That would be an opportunity to terminate the MOU. But the parties must provide each other with written prior notice of termination. So just some additional clarification added there. We can go to the next slide. All right, so just providing some clarification regarding next steps for the MOUs. So the managed care plans have a requirement to demonstrate a good faith effort to execute the MOUs by July 1st, 2024, and also the TCM programs. So we really wanted to just provide clarification on that. And also the MCPs will submit executed MOUs on a rolling basis. So anytime the MOUs are executed, we would expect to receive those MOUs. And then also just really notating that the MCPs are required to submit a quarterly report demonstrating that good faith effort. You're going to be using the existing processes that you're using now to report that information to the department. And then wanted to also provide clarification to our managed care plans that we expect to see that good faith effort on the July 31st quarterly reporting template that's due this upcoming July. So wanted to just provide some clarification on that piece. All right, we can go to the next slide. We're going to open it up to questions from you all. So please feel free to raise your hand, drop your questions in the chat. We are happy to answer any questions you have today. We also have some of our program SMEs here that are going to be assisting with some of the questions and answers today. All right, if we have questions regarding the monthly plan data feed files, where would we direct those questions? That is a great question. Does someone from potentially our ECM team have an email address where they may be able to ask questions related to the file that's being transferred to the managed care plans? If we don't have it, oh, go ahead.
From Pop Health here. Maura, I don't believe that I have more information on this particular file, but happy to take that back and think about it. And a follow-up question is this file specifically pertaining to ECM, or is this more broadly talking about the plan data feed file that managed care plans can receive from DHCS? Got it, specifically to TCM members. So I think that, Maura, this might be more of a TCM specific and non-ECM pertaining question then.
How about for now, if you have a question, please feel free to just send an email to the MCP MOU inbox, and then we can get you in contact with the appropriate people. That might be the easiest way to kind of streamline that moving forward, understanding that the responsibilities are split across multiple teams. So if you submit a request, we can get you in contact with the appropriate people. Yes, thank you, Sophie, for dropping that email in chat. I appreciate the quick response there.
Perfect. And this is Uma De Silva from Local Governmental Financing at DHCS. So for our TCM, we will be releasing some guidance on the managed plan data feed and how we can use that to receive the ECM overlap and the data from that. So just a heads up that it's coming.
Thank you, Uma. We appreciate you jumping in and clarifying there. Right. Do we have any hands raised? I don't see any, but want to make sure that I'm not missing anyone's hands raised if they have any questions. All right, I see another question. Regarding duplication of efforts, if our MCP member is getting services from ECM, are we saying ECM will be primary and not TCM? Also, the TCM liaison will be specific per region. Uma and David, did you want to take the first piece and then maybe I could provide some clarification on the liaison if that would be helpful?
Sure, yeah, I'm happy to take the first question, or first part of the question regarding ECM and TCM overlap. And so, yes, as specified earlier in Amara's slides and previous communications, DHCS is viewing ECM as the primary care management program for members enrolled in ECM. And outside of the two use cases outlined by Amara in the slides, pertaining to communicable diseases and programs that are home visiting to promote the welfare of children and families, members enrolled in ECM are not eligible for TCM because we would expect that the ECM service would be providing the full scope of services, including what would typically be viewed as the responsibilities of TCM.
Thank you. And then the assignment of the liaison roles are going to be specific to the area, the program area that you would be executing the MOUs in. And so, for example, you would have a liaison between the managed care plan and the TCM program for that responsibilities within the region. And so I would say there should be sort of a one-to-one relationship with the liaisons. However, there may be, circumstances where that may not be appropriate. So really encourage you to look at the local level nuances and make the determination based on that. And then also I see a comment in here. Could you provide the link to the TCM FAQ? Oh, okay, perfect. Yeah, just wanted to provide clarification that the link that Sophie dropped is an MOU FAQ, so it's not really specific to the TCM program exactly, but more specific to a lot of the policy guidance that we released related to the MOUs. So we will be looking to update that and incorporate some TCM specifics, but right now it's really more high level. I don't know, Uma, if there's a specific FAQ for the TCM program that may be helpful to reference. So if so, please feel free to drop that in chat.
So there is no FAQ, but I can touch base with Hansine after offline.
Perfect, thank you. Are there resources being provided to help plans identify which LGAs have TCM programs and who the contact people are? We are happy to do so. We understand that there has been some recent changes, so we're happy to make sure that that is clear. I believe that's something we are incorporating into the FAQ as far as like which counties operate TCM programs, but we are also happy to provide that clarification in advance. And then Uma, as far as the contact people, is that something that we would be able to provide as well?
I'm sorry, my computer is being a little slow today. Are we looking for contact people for the TCM program on the program side or LGA coordinators?
Who the managed care plans would be coordinating with to execute the MOUs, I believe that would be the question.
Right, so if they would like points of contact from the LGAs, they can reach out to us, and I'll share the TCM email here if that's helpful. So if they have any questions regarding points of contact, they can email us at DHCS-TCM@dhcs.ca.gov.
Perfect. Thank you so much. And then I see another question from Patrick. From July 1st, 2024, moving forward, will TCM participating county be able to bill for a Medi-Cal TCM encounter connected to a Medi-Cal TCM client who is also ECM eligible but not receiving ECM services, and therefore no ECM is being billed for? David, I'm going to pitch that over to you, and maybe if Uma has any additional information to provide.
Thanks. Yes, so I think that the information previously shared by Mara and me specifically pertains to duplication of services for people who are enrolled in ECM, meaning that as in Patrick's question, I think it pertains to members that may be eligible for ECM, but not enrolled in enhanced care management. And at that point, there would not be a duplication of services if a member is not enrolled in ECM for whatever reason, including choosing not to enroll in ECM, since enrollment is optional for a member. I would say that there are cases in which we are currently looking at where there might be an interface here where a member might be receiving a comprehensive assessment for TCM as part of TCM that reveals eligibility and need for enrollment in ECM. And we're currently reviewing that situation internally, and we'll be providing future guidance on that.
Thank you, David. And yes, I want to second that there will be guidance coming out. And we are drafting currently. We have not released this yet, but there will be a policy and procedure letter and attachments with more guidance on this.
Thank you both. I see a question from Dora. If we have existing MOUs with MCPs, can we invoice fiscal year 2024-2025 encounters, or do we have to have the new MOUs in order to invoice by July 1st? Uma, are you familiar with the invoice process by chance, and would you be able to assist with this question?
So for TCM claims for dates of service starting July 1st, 2024 and onwards, so currently the requirement is to have the MOU executed by that date. So we will not be processing invoices starting July 1st, 2024 for dates of service 2024 and onwards until we have an MOU, and that's a guidance that we have provided so far. But if you have, if you're running into difficulties having the MOU executed, please reach out to us and we will work internally to get those modes of communication going and try to assist us in any way that we can. And on a case-by-case basis, we might be able to work with you to make those exceptions if it's taking too long. But yes, please reach out to the TCM program for that.
Thank you so much, Uma.
Definitely.
Thank you. Great questions. Do we have any additional questions to drop in chat, or please feel free to raise your hand and we can call upon you to ask your question that you may have. I will give it just a little bit longer in case anyone has anything else to add. While we do that, I just really want to thank everybody for their partnership and collaboration on the development and finalization of this MOU. It truly is an example of collaboration at the state level and also at the local level. So really want to thank everyone's commitment to really supporting the goals of the MOU and ensuring that, Medi-Cal members are being supported in different delivery systems. So we really want to thank everybody for their partnership on this. And I do see another question that was dropped into the chat related to the non-duplication of services. So I will read the question and then ask for David and Uma to provide clarification if possible. Since both ECM and TCM are voluntary, does the member have an option to choose? If the MCP member is eligible for ECM but does not consent to participate in ECM, are they able to participate in the TCM program if eligible? So I think this one would be Uma, if possible, and then David, if he has anything additional to add.
So currently the guidance is not released as yet, but the guidance is leaning towards directing all ECM eligible members to ECM to avoid non-duplication. We will take that question back on what we would do if the member does not consent to receiving ECM over TCM, and we will get back to you.
Thank you. All righty. Well, we really appreciate the fruitful conversation today. And please know there's several channels. If you have questions, please feel free to reach out to us, as we are happy to support you all as you begin the execution of these MOUs if you haven't already done so. and really want to thank you all for your time this morning, and hope everyone has a great Monday.
Thank you.